Welcome to the What Are Emotions and Can They Save Us podcast. G'day, I'm Marcus Lovett, producer and host of the documentary What Ate My Mum and Will It Eat Me? And this is the health podcast that goes beyond the environment, beyond our diet and exercise, and goes deep inside to explore the effect emotions have on our health. Today I'm talking with Dr. Craig Hassard. He appeared in my documentary What Ate My Mum and Will It Eat Me? He has been instrumental in introducing a variety of innovations into medical education and practice, with an emphasis on the application of holistic, integrative and mind-body medicine in medical practice. Author of several books including The Essence of Health, he is a general practitioner and senior lecturer at Monash University, where he keeps quite busy.
Well, I lecture in a lot of faculties. And the lecturing I do is not just in the general practice teaching for the medical students. I teach across a number of subjects in the medical course, but also into about 11 different faculties at Monash, as well as doing a lot of work outside of Monash. Like this afternoon, I'll be with a cancer support group, and I work with MS groups and a whole lot of other community groups as well.
When you work with the cancer groups, how often does the discussion talk about emotions and the unresolved emotions being a bit of a cause for cancer?
Well, the talk I give in the cancer support program, which is a 10-day program, is all about the mind-body relationship and how also our state of mind can influence our lifestyle and the impact of lifestyle on health. So it comes up a lot in the sessions that I take with them, and certainly a lot throughout the whole program. It's one of the key elements, not just in terms of emotions and surviving cancer does it make a difference, but in terms of how a person lives with cancer as well, the quality of the way that they're living, as well as does it change outcomes.
Yeah, let's go. Take a step back and start straight at emotions. What is your definition of emotions?
I'm really not sure that it's so easy to define. Look, I think that the two main domains of the mind are thoughts and emotions. Thoughts are, I suppose, the sketched outline of what goes on in the mind. The emotions are the colour that give the picture its richness and character. And emotions are really the thing that give a thought its force, because a thought without any emotional impact behind it has really no force to move us physically, behaviorally, physiologically, and so on. So emotions are like the energy behind our thoughts, if you like.
Right. So often, our thoughts are supposedly located in our mind. I mean, there are some people out there that think differently, like Rupert Sheldrake. But emotions, where are emotions?
Well, that... if we're going to think that we can just wall emotions off and say, well, it's just a little bit of activity in the limbic system in the brain, and then that's just ridiculously superficial, because the brain, what we think, and I mean, this is a whole metaphysical discussion as well, that is the mind just the brain, or is the mind something that's non-physical that talks through the brain and so on? And I perhaps won't get into that. But when we experience an emotion, it's not just something happening in the brain. There's a cascade of effects that go right through the body and communicate basically with every body system. So it communicates with our cardiovascular system, the respiratory system, our immune system, physiologically, metabolically, immunologically, even down to our DNA. So our state of emotions have been found to have quite a profound effect on the DNA. So emotions are not just contained in our skull. And anybody who's just paid attention to their bodies for 5 seconds will notice that our emotional state is influencing what's happening in our body every moment.
How are you feeling right now?
I feel fine.
Oh, I'm just saying, are you in like a happy state, or is it like curious? But if let's say emotions are like you said, it's not clear cut and they're just in the brain, they're all over the place and we can feel them. How do they communicate? You know, often we're taught things communicate chemically in the body,
Yes.
but emotions happen so quickly.
Well, they do, but that communication through the nervous system only takes a split second to start to have effects right throughout the body. So there's the quick communication through the nerve fibers, and there's a slower form of communication. So I suppose you could call that the cable network. And then there's a slower communication by releasing other chemicals into the bloodstream, and they can start to have effects anywhere from seconds to minutes to hours later. So that's, I suppose you'd say, a postal system, if you like. But that communication of emotions from the brain throughout the rest of the body takes place very quickly.
Why do we have emotions? Like, what's the purpose of them?
Gee, I'm not sure that there's any one answer to that question, but I dare say it's the thing that really motivates and engages and moves people, and not just people, but of course animals have emotions as well. And it's the thing that really moves and motivates. As I said, a thought without an emotion behind it has got no energy, no drive. It's not going to move a person. And so it's not just what gives a bit of colour and interest and engagement to life, but it's how we communicate, how we live, how we relate to each other. And emotions have got enormous roles to play, not just in relations between individuals, but in how communities relate with each other and how we relate with the wider environment.
How important are the emotions to our overall health?
Well, profoundly important. So, for example, I guess what we might say is poor mental or emotional health is associated with much higher rates of illness. So, for example, at least 3 times, maybe even up to 5 times the risk of cardiovascular disease for a person who's had long-standing major mental health problems like clinical depression. Now, having said that, I think it's really important to very quickly say that people that improve their mental and emotional health have an effect of reversing that particular kind of statistic. But that's just an illustration. With cancer, it's probably not quite that extreme an effect, but probably close to doubling the risk of a variety of cancers. So, with significant ongoing clinical depression. And there's a whole range of physiological and metabolic reasons for that, as well as risk of autoimmune conditions, poor immunity, higher risk of infections, more severe infections, more rapid aging from DNA to the aging of the brain. So it's really has quite a profound effect.
I remember you telling me in the interview in the documentary "What Ate My Mum, Will Eat Me" that you, and this is what really hit me, was about physical exercise and how important just physical exercise is to on beating cancer or just your overall health. Which comes first, the emotional drive to exercise, or the exercise improves the emotional health?
It goes both ways. If we're not feeling well mentally and emotionally, it's hard to motivate ourselves to do the other things that are healthy for us, like exercise and eat well and so on. But equally, healthy lifestyle has a beneficial effect on our mental and emotional state. So it really goes both ways. And that's, healthy lifestyle is a mental health intervention in itself. But of course, this needs to be taken into context as well, because the mind is so important in our physical health. Doesn't mean that it's only the mind that matters, because the mind has effects directly on us physiologically, metabolically, immunologically, etc. But it has indirect effects because our state of mind, it's what goes on in our mind that determines whether we exercise, whether we eat well, whether we work, whether we sleep well. And so it's those indirect effects that are very important also.
How would you describe a person with healthy emotions? Like, what would be a healthy set of emotions?
Well, I think part of that is being at peace with our emotions. Now, that might mean being at peace in terms of a deeply meditative or peaceful state. But it also means to be at peace with our emotions doesn't mean that we don't have emotions. So we might be experiencing sadness over something that is entirely appropriate to feel sad over, like, my father died a couple of years ago, and spent about the last 7 days of his life, lived in country New South Wales, and so I went up to be with him for about the last 7 days, much of which was spent at the bedside. And for me, it felt entirely appropriate to feel sad, and particularly, seeing somebody so close to you who's experiencing discomfort at various times, and that sadness is entirely natural. I didn't feel like, oh no, don't feel sad, and so on. It was just like natural to feel it, natural to express it, and to express it in a way that one feels comfortable with. When we're experiencing emotions that are fighting with each other and we're suppressing them, we're getting reactive to them and so on, or we're wallowing sometimes in negative emotions, as can happen when we're feeling very down on ourselves and so on. And that's not necessarily so helpful. So being healthy emotionally, I think it means like a piano. There are many, many different octaves, and in a sense we've got the ability to play the full range of emotional states. And, in certain situations, anger could be a healthy emotion. Experienced, it could have its appropriate place. We express it in a way that is not venomous and destructive. It gives perhaps some emotional weight and directness, to dealing with the situation. And then we don't carry away baggage from it afterwards. But, so even something like anger or sadness, they could be very positive and natural emotions. But much of what we call anger these days, for example, is based on a distorted perception of the situation, overreactivity, suppressing it and fighting with it, is not necessarily healthy. So I think being at peace with ourselves, feeling at peace and expressing our emotions in a way that we feel happy with, that does not leave a residue afterwards, I think is a healthy emotional state. It's not a bland, one-dimensional kind of walking around with a grin on our face the whole time, because I don't think that's the way that life is.
So would you say, like, with anger, especially, let's say someone who's quite maybe a violent, angry person, and they lash out, and they've released that anger, and they feel better after it and walk off. Of course, then they may have a problem of, they've got to apologize and feel bad about themselves for doing something that they regret. So is it more to the point of being mindful of our emotions?
Well, I think being mindful of our emotions and mindful emotional regulation, which is not, in a sense, trying to control emotions or suppress them, but learning not to be controlled by emotions, gives us a little bit more space and a little bit more ability to choose whether or not to express an emotion, or if to express it, how to express it. So if we're not mindful and we're just running on automatic pilot and so on, something happens, bang, there's a reflex angry response, we say or do something without really much thought or consideration, and then afterwards it's like damage control. Then that's not necessarily going to be helpful, even if we feel like, I'll use a metaphor here. It's like having something in our eye, and the temptation is to rub it, and you rub it and you feel better for about 2 seconds, and then afterwards it's just more deeply embedded than it was before. And I think that lashing out and a very unmindful expression of anger is going to cause more harm than good. But, we may be mindful sometimes and notice that, no, something does need to be said. But if it's being said in a mindful way, it won't have a malicious or destructive intent. It'll be to the point, no more forceful than is required to deal with the situation. And generally, it's actually, strangely enough, is being expressed with an understanding of the other person's perspective and needs and feelings as well. And it doesn't leave the residue afterwards that less mindful expression of anger does. And so now, when a person expresses or is, I suppose, much more angry and prone to anger and aggression, then it's very much reflected in also the way the brain's wired. So the brain's been wired for reactivity. The amygdala, or the stress center in the brain, is much bigger and more reactive. And the areas of the brain that are meant to be regulating emotion aren't working so well. So particularly for men who've got issues around aggression and violence and hostility, the stress center in the brain's firing off a lot, and the other higher centers in the brain are really not getting a message through very well at all. And so when people actually learn to be more mindful, learn to manage their mental and emotional health better, then that stress center in the brain tends to quieten down. The executive functioning areas, the frontal cortex of the brain, starts to work a little bit better, and the person starts to feel, within themselves, they start to feel better and start to feel happier with the way that they're expressing emotions, so able to communicate, but not necessarily in an aggressive way, but maybe in an assertive way that is that communicates better what their actual concerns are.
What can we do, like on a daily basis, to improve our emotional health?
Well, I think obviously I have a strong interest in mindfulness, and I think that mindfulness meditation and learning to be mindful more often in our day-to-day life is a really good place to start. I think being able to communicate better, learning how to communicate, and not just in the habitual ways we might have grown up with, like just raising the voice and trying to force opinions and views onto others. So to actually be able to communicate in a more balanced kind of way. But that includes being able to listen better, to actually hear other people's perspectives without being too quick to judge or react. Helps us to actually make that communication a two-way thing. Relationships, and I think that doing things in our life that renew and refresh us and invigorate us help to keep our emotional state a whole lot better as well. And then there are whole strategies based on mindfulness, like mindfulness-based cognitive therapy or MBSR, mindfulness-based stress reduction, and other kinds of mindfulness programs, or CBT. So these kinds of therapeutic approaches can be very helpful for fostering better emotional states as well.
How do emotions, or first of all, do you believe emotions cause disease? Can they cause disease?
They can cause disease or accelerate the progression of a disease that's already there, but it should not be taken in isolation from a person's genetic makeup, their lifestyle, their exposures environmentally, chemically, and so on. So it shouldn't be taken out of us in isolation from all of these other things as well.
So there is no silver bullet really to cancer. It's a whole, like you said, you're holistic. And you look at everything. There are, like Louise Hay talks with, you can heal your life, and there's a few other out there that really associate parts of your body and illness to mental and emotional problems. How accurate is that?
Well, when I'm asked about this, for example, saying cancer support groups and so on, this is a pretty vexed kind of area. And I'll just sum up, reading what somebody says in a book is one thing. I think it's really important to look at what the best evidence says as well. And this is not easy to make sense of. And I think that, there's no one answer to that. But I'll just say a few of the things that come up from the research. Now, does, inverted commas, stress cause cancer? Now, there have been a lot of studies that have attempted to look at that. Now, and it's very mixed findings from those studies. So some studies look at like life events, like divorce or the death of a spouse, for example, and does that increase the risk of cancer? Say, take with breast cancer, there's many, many more studies on breast cancer than any other cancer by a long way. And reviews say, well, no, those kinds of life events, i.e. stressful life events, don't necessarily increase the risk of cancer. But there are other reviews that suggest, well, wait a sec, it's not the life event by itself. It's the way the person perceives or responds to or experiences that event that determines whether or not there's an increased risk. So, for example, is going through a divorce a stressful life event? Well, for some, it might be a stressful life event, but for others, it's a relief of stress. And if these studies don't take into account the individual experiencing that event, then they don't find an effect. But if they do take into account the person's experience of that event, yes, it was significantly traumatic over a prolonged period of time, and so on. And when you actually follow those people up and try and control for the other risk factors, there does seem to be an increased risk. Not quite doubling the risk, but in that sort of ballpark, about an 80% increased risk after the other factors have been controlled for. Now, what does seem to be clear, and if we just sort of put the word stress to one side and perhaps put the word mental health in its place, and so there are a number of studies looking at, say, does major depression increase the risk of cancer? Then those studies tend to suggest it does. And again, getting close to that sort of doubling the risk after other factors have been controlled for. So poor mental health, and significantly poor mental health, we're not just talking about normal day-to-day ups and downs, but significant prolonged poor mental health does seem to be associated with a higher risk. Or for a person who already has cancer, and the work of David Spiegel has been quite influential here. He's followed, again, there's more research on breast cancer than any other cancer, but they're looking at, for example, in one study, women with breast cancer, and they looked at the following year after their diagnosis, what happened in terms of their depression scores. And the women who had increasing depression scores, so that is escalating levels of depression, compared to those who had depression scores that went down over that year. And they found that those with the higher depression scores, when they followed them up over a number of years, had roughly half the survival compared to those who had reducing depression scores. So that is, worsening depression is a poor prognostic sign. There have been other studies that look at maybe some of the reasons that explain those kinds of findings, the effects on immunity, effects on genetics and telomeres, effects on DNA damage, the physiological and metabolic effects that try and explain that. But that seems to be a reasonably valid kind of finding from the research. Now, whether if somebody's got unresolved things and don't speak their mind and they're more likely to get a throat cancer, or if a person has got other kinds of emotional issues, they're more likely to get a cancer in this part of their body and so on. I don't think that there is evidence I've been convinced of that suggests that that is the case. But I think this broader issue, that mental and emotional health seems to be an important factor in causation and progression, but should not be taken, a person's just caused their cancer by the way they think. It should not be taken out of context with all of the other things that go on in a person's life. Have they smoked? Their environmental exposures? What was their lifestyle? What's their family history? All of those things need to be taken into account, because we're just talking about here risk, increasing or reducing risk, or increasing or slowing down progression.
If you were to come in with a major illness, a heart or cancer or whatever, just a major illness, what would be your first steps to going, okay, I've got a major illness, I've got to do something? What would be your process?
Well, the first thing I want to do is get my mind right. And we can do a bit of that for ourselves, but I think that and being able to find somebody, a professional, who can help us to work on our mental and emotional health would be very useful, as well as good support in our personal life and so on. I'd be looking at my lifestyle and what healthy changes I could make in that area. And I would be wanting to find a very good expert in the particular condition I had. And I would try and find a specialist with the most holistic perspective on the management of that condition that I could find, so that they could advise me about the best kinds of treatments that are available. And I wouldn't assume that more treatment means a better outcome. I just want to know which treatments are likely to have the best effect, and to try and make the best decisions about which treatments to undertake. And I would also want a very good general practitioner who can help and support and provide all of the other advice and support that might need, and other allied health professionals who might have particularly important roles to play as well. It could be anything from physiotherapists and, dietitians and others that may add a lot of value to the overall healthcare. So, and I'd be looking as well, if it was a major condition, what kinds of support groups are around. Where you can go and you can meet and be inspired by others who are dealing well with that condition, and get useful advice and support. And so I think that there's many different things that we could do. I certainly wouldn't want to be sitting in a room by myself and just draw the curtains and think negatively about my future and prospects. I would want to be a very active participant in my own healthcare.
But it's like the very first thing you said was mind. And do you think the GPs, especially been putting up by Monash, but from anywhere, are now, when someone comes into a health problem, they look at the mind first? Do you think this, is this growing? Because, they've had a reputation in the past. It's just like, okay, you've got this condition, give this treatment.
There's a lump, just cut out the lump next.
Yeah.
And I think that there are, the system often doesn't make it easy for the health practitioners within the system to work more holistically, to spend more time with the person. So in part it's a systemic issue, but it's also a training issue. Very often doctors have been trained in a very narrow kind of way, don't think of the other issues, don't think of the importance of the mind. But I'm hopeful that as time goes on, as the science in this area matures, that there are going to be more and more doctors and health practitioners generally who are going to realise that the mind's a very crucial factor, not just in how the person copes with the condition, but also in terms of improving outcome, and also in being a very important foundation upon which they engage with the medical treatments and the lifestyle and self-help strategies that could be important for them.
Thank you very much, Craig. It's very good information in there.
Just a few resources that might be very helpful for people as well. Say there's a documentary called The Connection. Have you heard of that?
No, I haven't heard of it. Called The Connection. The Connection.
It's all about the mind-body connection. It was put together by Shannon Harvey, who's based in Sydney. And Elemental Media, that's her company. But she had a tremendous outcome from mind-body interventions for her own autoimmune condition. But as a journalist, she decided that she really wanted to make a documentary on this. So I really highly recommend that to yourself and to all of your listeners. And also, if people are interested in mindfulness, there's the mindfulness manual as a part of that connection as well, which is an ebook I put together as a companion to that documentary. And it's got lots of embedded mindfulness practices, but also lots of the science and the background about the mind-body relationship. So there are a couple of things I'd recommend as well. If people want to read more into mindfulness in more depth, then Mindfulness for Life with Exile Publishing would be worth having a look at too.
Oh, excellent. Thank you so much for all that. In fact, I'll make sure I put all that up on the web as well, so people can link straight to it.
Yeah.
You have been listening to a What Are Emotions and Can They Save Us podcast. Thank you so much for listening. And I would like to thank my guests, for this would not be possible without the generous sharing of their time and knowledge. To discover more about emotions and their importance, you can go to the website whatatemymum.com, or you can follow me on Twitter at whatatemymum, or like my Facebook page, What Ate My Mum, or simply Google What Ate My Mum. Until next time, keep the spirit.